Hi everybody, Dr. Ahles here. In this short video, we're going to talk about the coronary circulation, which is the blood supply that specifically goes to your heart. An interesting and important fact about the heart is that even though it's constantly pumping blood, all that blood inside of the heart does not share oxygen or nutrients with the heart muscle itself. The heart muscle is constantly contracting though, and muscle contraction takes nutrients and oxygen. So we have what's called the coronary circulation, which is a group of blood vessels that are found on the outside of the heart. These are the blood vessels that specifically give it blood supply. So all that blood that's inside of it, not helping it to breathe, in air quotes, or to eat, again in air quotes. It has to have its own coronary circulation to do that. So when we talk about the coronary circulation, the first thing we have are called the coronary arteries. And the coronary arteries branch directly off of the aorta. Remember that the aorta brings oxygen-rich blood to the entire body. So very shortly after blood passes through the aortic semilunar valve, we have these two little arteries called the coronary arteries that branch into several smaller pieces that brings the blood to each of the chambers of the heart. And remember, we're on the outside of the heart, so we're bringing it to that muscle tissue that we see on the outside. Blood can only go into these blood vessels when the heart is relaxed. So remember, my word for relaxing is diastole. So when the heart muscle is relaxed, diastole, blood comes from the aorta into these coronary arteries and brings oxygen and nutrients to the heart tissue. Once the oxygen and nutrients are out of this blood, now this blood is oxygen poor, we need to get rid of it using veins. So the coronary veins are what gets rid of the oxygen poor blood from that muscle tissue on the outside of the heart. The coronary veins drain into something called the coronary sinus, which is this really big vein that we see here on the back of the heart. The coronary sinus is actually directly connected to the right atrium. Remember that the right atrium is the place where all of the oxygen poor blood from the body goes into. So when we're done with the blood that's circulated through the coronary circulation, it actually goes right back into the pulmonary circulation, into sending blood out to the lungs to get oxygenated again. When we look at the amount of blood supply or the number of blood vessels in the coronary circulation, the place of the heart that has the most coronary blood vessels is the left ventricle. And think about this, the left ventricle is where we had the thickest myocardium, because the left ventricle is what we used to pump blood to the entire body. So we make sure that especially this chamber of the heart with the thickest muscle doing the most work has a lot of blood supply. But every chamber of the heart, still needs some blood supply. Everybody's got to get oxygen and nutrients through the coronary circulation. What happens if that coronary circulation malfunctions? Remember, the blood inside the heart doesn't help the heart to get the oxygen and the nutrients it needs. So, if for some reason I see a narrowing of the blood vessels in the coronary circulation, the first thing I might notice is what's called angina. So angina is kind of a tightening or a squeezing in the chest. It's not as severe as a heart attack, which we'll talk about in a moment, but this pain that comes and goes in patients is often a symptom or a way for doctors to diagnose coronary artery disease. So coronary artery disease is when the blood vessels around the heart become narrow. So as they're narrowing, the cardiac muscle of the heart isn't getting as much oxygen or nutrients. If we're still getting some, you'll just feel this pain or this pressure. But if a vessel gets completely blocked, so for example, we have this plaque build up inside the blood vessel, and then for some reason we build a blood clot in there, maybe there's trauma, maybe the blood is just not acting like it should, This would create a clot that completely blocks blood flowing to different parts of the heart. This is what's known as a myocardial infarction, also known as a heart attack. The pain that a patient feels during a heart attack is literally coming from dying cells. So if I cut off blood flow to any part of the heart, any part of the body, those cells that live there no longer have the oxygen and nutrients they need. So we see parts of the heart where the muscle is literally dying, leading to the pain that you would see with a heart attack. The biggest problem that we see with myocardial infarction or heart attack is that once we restore blood supply to those parts of the heart, what comes back in its place is scar tissue. And that scar tissue is not able to contract like the cardiac muscle was. So if my heart, which needs to pump blood constantly to everywhere in the body, can't contract as strong anymore, that's going to be a challenge for me. So when we think about a heart attack, a myocardial infarction, this comes from issues with our coronary circulation, which is the only blood supply that helps my heart survive. A quick note, I'm not going to test you on this, but I want to point out that when we talk about a myocardial infarction, a heart attack, the symptoms in men and women actually are a little bit different. So when we think about the symptoms that are common to both sexes, you'll see some pain. In men, it's maybe more localized down lower, kind of in the back. In women, it kind of tends to be up a little bit higher, maybe between the shoulder blades. Both sexes may experience chest pain, although that tends to be much worse in males than in females. And both will exhibit some shortness of breath. We're not able to breathe quite as well. But interestingly, in women who have a heart attack, we also see some other symptoms that come with it. So for example, women might start to feel suddenly very dizzy, or it may feel like they have heartburn. That chest pain would feel more like heartburn. Nausea and vomiting, more common in females, as well as things like being unusually tired for an extended period of time. And think about this one. If my coronary arteries are blocked, my heart can't function as accurately or as well. And if my heart's not functioning correctly, I can't get blood supply to my entire body. That would make me feel very tired. So why am I showing you this stuff? Just to point out that as future medical professionals, if you see a male having a heart attack, he may have different symptoms than a female having a heart attack. This is why women with heart attacks, often it takes a lot longer for them to be diagnosed, because their symptoms don't exactly match the kind of symptoms that we would see in men.